Dr. Melvin Nario of Biointegrative Health Center. Welcome, Doctor.
Hi, Steve. Thank you for having me again. Always a pleasure.
I know that people that come to the clinic, your clinic, sometimes, they're getting treatments for, like, sometimes my wife, even, they're getting treatments for certain things to help their body. Or they may be treating something that's more serious. My wife and I just go for, you know, to be healthy and to, it's preventative. But I know sometimes people will have back pain or joint pain or um, some type of pain in their body. You can also help with that naturally, right?
Yes, correct. So there are ways that we assess pain, and pain is a bugger. Nobody wants to have pain. So maybe acute or chronic. We just want that to be eased out or hopefully eliminated completely. The things here we have many options for our patients, especially through our IV infusions, injectables. One that I always kind of go for in general is sodium bicarbonate. And this is a typical patient that I always see is comes in from with muscle aches, burning, stomach aches, and most of the time athletes who builds up what we call lactic acid when it occurs during their intense exercise. So this is basically what we call lactic acidosis. And again, to neutralize acid, as we all know, we need bicarbonate. So we're not going to get baking soda from the store for you and give it to the patient as an injectable. But this is something medically made and medical grade so that it can actually be given to the patient to neutralize this acidity, thus lessening the pain. Another one, vitamin C. As we all know, vitamin C is a powerful antioxidant that fights, again, joint inflammation that is caused by oxidation or oxidative stress. And again, that's why the word powerful antioxidant, because this oxidation actually produces the pain and stimulates the nerves in a bad way. And vitamin C, as you all know, is a cofactor for collagen to make sure that the joints are actually intact so it can form more proteins such as muscle and cartilage to support that damaged area. And if people really want to go for natural, we have homeopathic, sources such as Tramiel, as we call it. But and also the thing here is what is in Tramiel, right? Tramiel is again a homeopathic remedy. It's from Germany. Sometimes you can get it, sometimes you can. So it's very hard to source it nowadays. But what's in it would be the components of arnica, echinacea, chamomile, and that's why it's very effective for pain who really wants to do this naturally. But you have to remember, we are also conventional docs, and we still use prescription medicines for these pains, for example, that are very acute and are very distressing for the patient. One that we use is called Toradol. It's a non-steroidal anti-inflammatory, and it's actually an injectable or can be mixed in an IV, and it's quick to actually promote the relief of pain, and it can even last up to like 6 hours. So this is something that again is comparable to oral Tylenol, but more potent because it's injectable. And of course, for chronic pain, we also have the steroid medicine called dexamethasone, and it relieves, of course, patients from chronic inflammation that they have experienced, such as, for example, the severe pain of gout, and even, for example, dental procedures that or swelling that they are experiencing, and even sometimes back pain. But again, rarely do we use this because, again, I'm not a big fan of prescription because of the side effects. I rely more on the naturals.
Well, that is great information, and it's just kind of a broad range of things that you can do, depending on the patient, obviously. And I know, again, you guys can mix these things. Some of these things can be mixed if maybe somebody's being treated for something else, and you can mix this in an IV a lot of times, right?
IV injections, yeah, some of them are oral, but yeah, more potent would be, of course, going into that bloodstream.
Okay, so if you guys have questions about what we're talking about here and what the options are, and you have any issues with your body, especially if you've tried things that haven't worked, um, I love this clinic. So, um, If you guys have questions, again, leave them in the comment section. You can check out Biointegrative Health Center online. You can see what they do, and you can see how to contact them if you're interested in finding out more. So thanks for being with us, Doctor.
Again, thank you, Steve, for having me. As we all know, knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.